There are four specific symptoms that appear in the bodies of adults over 60 that most people dismiss as normal aging. Fatigue that sleep does not fix, swelling in the legs and ankles, unexplained shortness of breath during activities that never used to wind you, and a persistent brain fog that makes thinking feel like pushing through wet cement. These four symptoms, when they appear together, or even in combination of two or three, are not the inconveniences of getting older. They are the warning signals of organs that are under serious stress and beginning to lose their functional capacity. And the reason they are so dangerous is not just what they mean individually. It is what they mean when the body is producing all of them at once, because when these four symptoms appear together in an adult over 60, they are almost always telling the same story about what is happening at the cellular and organ level, and that story requires immediate attention rather than quiet acceptance. My name is Dr. Darius Coleman. I am a senior healthcare specialist with 16 years of clinical experience working with adults over 55. The four symptoms I am describing today are among the most consistently underreported and undertreated warning signs in older adults, not because physicians do not recognize them, but because patients have typically been living with them long enough that they have stopped mentioning them. They have normalized the fatigue. They have started avoiding situations that expose the breathlessness. They have adjusted their footwear to accommodate the swelling. They have stopped reaching for words they cannot find as quickly as they used to. And by the time these symptoms reach a clinical threshold that generates an urgent medical response, the organ damage they reflect has typically been building for months or years. I want to ask you something before we go further. And I genuinely want your answer because it tells me something important about who is watching this video. Of these four symptoms, which one have you been living with the longest without having it properly investigated? Fatigue that sleep does not resolve, swelling in your lower legs or ankles, breathlessness during ordinary activity, or persistent cognitive fog? Drop your answer in the comments right now, because the pattern of which symptom appeared first and which developed later carries real diagnostic information, and understanding your specific pattern is the first step toward understanding what your body is actually trying to tell you. The first symptom is persistent fatigue that is not relieved by rest or sleep. And the reason this symptom is so critical to understand correctly is that it is almost universally misattributed to aging, depression, or simply not sleeping well enough. The fatigue that signals serious organ stress in adults over 60 has a specific character that distinguishes it from ordinary tiredness. It is present upon waking, not just at the end of a long day. It does not improve proportionally with increased rest. It is accompanied by a physical heaviness, a sense of effort required for movements that should be automatic, and it persists regardless of sleep duration or quality. This is not tiredness from exertion. This is cellular energy failure. The primary biological mechanism behind this type of fatigue is mitochondrial dysfunction compounded by reduced cardiac output. After age 60, mitochondrial efficiency in muscle cells and organ tissue declines progressively. The mitochondria, the structures inside each cell that generate ATP, the molecule that powers every physical and cognitive function in the body, become less numerous and less efficient. A body with declining mitochondrial function produces less cellular energy from the same caloric input. Every physical task requires a higher percentage of the body's total energy reserves. The result is a fatigue that appears disproportionate to the activity level that produced it. When this fatigue is compounded by early cardiac insufficiency, a condition in which the heart is still functioning but with reduced pumping efficiency, the picture becomes significantly more serious. The heart's reduced ability to deliver oxygenated blood to peripheral tissues means that muscles and organs are operating in a state of chronic mild hypoxia, insufficient oxygen delivery relative to their metabolic demands. Cells running on reduced oxygen produce energy less efficiently, generate more metabolic waste, and send persistent distress signals to the brain that are experienced as unrelenting exhaustion. A study published in the Journal of the American College of Cardiology found that adults over 60 with persistent unexplained fatigue had a 34% higher prevalence of early-stage cardiac dysfunction on echocardiographic testing compared to age-matched adults without fatigue, the majority of whom had no prior cardiac diagnosis and had attributed their fatigue entirely to aging. The action this symptom requires is not acceptance. It is investigation. Persistent fatigue that does not resolve with adequate sleep and reasonable rest, particularly when it is accompanied by any of the other 3 symptoms in this video, warrants a conversation with your physician that specifically includes cardiac function testing, kidney function panels, thyroid evaluation, and a complete blood count to assess for anemia, all of which are common and treatable drivers of this symptom pattern in adults over 60. The second symptom is swelling in the lower legs, ankles, and feet, a condition called peripheral edema, and the reason it belongs on this list alongside fatigue is that it is one of the most reliable external signs of internal organ stress available to the naked eye. Most adults who develop leg and ankle swelling are told to elevate their legs, reduce sodium intake, and wear compression stockings. This advice manages the symptom. It does not address the organ dysfunction generating it. Peripheral edema develops when fluid that should remain inside blood vessels leaks into the surrounding tissue. This happens through 2 primary mechanisms in adults over 60. The first is elevated venous pressure. When the heart's right ventricle is not pumping efficiently, blood backs up in the venous circulation, increasing the pressure inside veins and capillaries and forcing fluid through vessel walls into tissue. The second is reduced plasma oncotic pressure. When the kidneys are not functioning optimally or the liver is under stress, the production of albumin, the protein that holds fluid inside blood vessels, declines. With less albumin in the bloodstream, fluid migrates more readily into surrounding tissue. Both mechanisms reflect organ systems that are under stress and losing functional capacity. Gravity pulls leaked fluid to the lowest point of the body, the legs, ankles, and feet, during upright activity. This is why edema is characteristically worse at the end of the day and improves overnight when lying flat. The presence of pitting edema, swelling that retains the indentation of a finger pressed into it, is particularly significant because it indicates a larger volume of fluid accumulation and a more pronounced underlying pressure or protein imbalance. A study published in the European Journal of Heart Failure found that adults over 60 presenting with new or worsening peripheral edema without a clear mechanical explanation had a 41% prevalence of underlying cardiac dysfunction on subsequent cardiac imaging, the majority of whom had not previously been diagnosed with any cardiac condition. Edema that is new, progressive, or present in both legs simultaneously, and that cannot be explained by prolonged standing, recent travel, or a known medication side effect, deserves prompt medical evaluation, not a compression stocking and a dietary adjustment without understanding what is driving it. The nutritional interventions that support the vascular and cardiac mechanisms underlying edema include adequate protein intake to maintain albumin levels, a minimum of 1.2 grams of protein per kilogram of body weight daily for adults over 60, combined with potassium optimization to counteract sodium-driven fluid retention. Cooked white beans, lentils, baked potato with skin, spinach, and avocado provide the highest potassium to sodium ratios of any common foods and directly support the kidney's ability to regulate fluid balance. But dietary intervention alone is not a substitute for understanding the organ mechanism generating the edema. Investigation and intervention must run simultaneously. The third symptom is unexplained shortness of breath during activities that previously required no effort, climbing a single flight of stairs, walking to the mailbox, carrying groceries from the car. And the reason this symptom belongs at the center of this conversation is that it is the most direct external signal of cardiovascular and pulmonary stress available without any testing at all. When your body cannot maintain adequate oxygen delivery to working muscles during activities that should be within comfortable aerobic capacity, something in the oxygen delivery system is failing. Either the heart is not pumping efficiently enough to increase cardiac output in response to demand, the lungs are not exchanging gas effectively, or the blood is not carrying adequate oxygen. And in adults over 60, all three of these mechanisms can operate simultaneously and compound each other. The cardiac mechanism behind exertional dyspnea in older adults is most commonly diastolic dysfunction, a condition in which the heart muscle has become stiffened and less compliant, impairing the heart's ability to fill efficiently between beats. Unlike systolic dysfunction, where the heart's pumping strength is visibly reduced, diastolic dysfunction maintains a normal ejection fraction on standard testing, while the filling abnormality remains undetected unless specifically looked for. Adults with diastolic dysfunction can have completely normal standard cardiac testing while experiencing significant symptoms on exertion, which is why many patients are told their heart looks fine after testing that did not include the specific measurements needed to detect diastolic impairment. The pulmonary mechanism most commonly contributing to exertional shortness of breath in older non-smoking adults is reduced lung elasticity and diminished respiratory muscle strength, both of which are progressive with age, and both of which are significantly accelerated by physical deconditioning, chronic low-grade systemic inflammation, and inadequate dietary antioxidant intake. The lung tissue itself ages, alveolar surface area decreases, gas exchange efficiency declines, and the respiratory muscles that power breathing fatigue more quickly at the same workload than they did 10 years earlier. A study published in the American Journal of Respiratory and Critical Care Medicine found that adults over 65 who experienced new or worsening exertional breathlessness had a combined prevalence of cardiac, pulmonary, or combined cardiopulmonary pathology of 78% on comprehensive testing, meaning that in nearly 4 out of 5 older adults reporting this symptom, something clinically significant was contributing to it. Shortness of breath during ordinary activity is not a fitness problem to be solved by doing more exercise before understanding what is generating it. It is a signal that warrants investigation of the cardiovascular and pulmonary systems that are supposed to manage oxygen delivery under exactly these conditions. The dietary interventions that specifically support cardiovascular and pulmonary function in older adults include consistent omega-3 fatty acid intake from fatty fish 3 to 4 times per week. EPA and DHA directly reduce the vascular inflammation that contributes to arterial stiffness and cardiac diastolic dysfunction. Dark leafy greens, providing dietary nitrates to restore nitric oxide-mediated vasodilation. And adequate vitamin D, which supports both cardiac muscle function and respiratory muscle strength and is deficient in an estimated 70% of adults over 60. None of these interventions replace medical evaluation of new or worsening breathlessness. They support the underlying biology while that evaluation is pursued. The fourth symptom is persistent cognitive fog, difficulty finding words, slowness in processing information, a sense that thinking requires noticeably more effort than it used to, and a reduced ability to hold multiple pieces of information in working memory simultaneously. This symptom is the one most consistently attributed to normal aging, and it is the one that most often reflects something that is both more serious and more reversible than the attribution suggests. The most common biological drivers of cognitive fog in adults over 60 are cerebral hypoperfusion, reduced blood flow to the brain, systemic inflammation crossing the blood-brain barrier, thyroid dysfunction reducing the metabolic rate of brain cells, sleep architecture disruption preventing the memory consolidation and toxin clearance that should happen during deep sleep, and the accumulated effect of the micronutrient deficiencies, particularly B12, magnesium, and omega-3 fatty acids, that impair neuronal function at the cellular level. Every one of these mechanisms is modifiable. None of them are the inevitable consequence of age, and most of them are directly connected to the same cardiovascular and metabolic processes driving the other 3 symptoms on this list. Cerebral hypoperfusion, the brain receiving less blood flow than it needs for optimal function, is the neurological downstream consequence of the same cardiac and vascular dysfunction that produces fatigue, edema, and breathlessness. When the heart's pumping efficiency declines, the brain is among the first organs to reflect the reduced perfusion in functional terms: slower processing, reduced working memory capacity, increased cognitive effort for tasks that previously felt automatic. This is why cognitive fog appearing alongside the other three symptoms is so significant. It is not a separate problem. It is the same problem expressing itself in the organ most sensitive to changes in circulation and oxygenation. A study published in JAMA Neurology found that adults over 60 with measurable cerebral hypoperfusion on imaging had a 3.6 times higher rate of clinically significant cognitive decline over 5 years compared to those with normal cerebral blood flow, and that the degree of cognitive decline correlated directly with the severity of the perfusion deficit. Improving cardiovascular function improves cerebral perfusion. Improving cerebral perfusion slows cognitive decline. The connection is that direct and that well established. The dietary interventions most strongly supported by evidence for cognitive fog in older adults are consistent daily omega-3 DHA intake from fatty fish or algae-based supplementation. DHA is the primary structural fatty acid in neuronal membranes and is required for synaptic function and neuroplasticity. Adequate B12 from animal protein sources or supplementation, B12 deficiency, which affects up to 20% of adults over 60, produces cognitive symptoms that are often indistinguishable from early dementia and that resolve completely with B12 restoration. And consistent dietary antioxidants from berries, dark leafy greens, and colorful vegetables to reduce the neuroinflammation that impairs synaptic efficiency and accelerates the cognitive decline associated with vascular aging. Here is what these 4 symptoms mean when they appear together, and what to do about it starting today. Fatigue that sleep does not fix, swelling in the lower legs and ankles, breathlessness during ordinary activity, and persistent cognitive fog are not 4 separate age-related inconveniences. They are 4 expressions of the same underlying biological deterioration: declining cardiovascular efficiency, reducing oxygen and nutrient delivery to every organ and tissue in the body, accumulating metabolic waste impairing cellular function, and the systemic inflammation and micronutrient depletion that both drive and result from this deterioration. The medical response to this symptom cluster must include cardiac evaluation, kidney function testing, thyroid assessment, complete blood count, and B12 and vitamin D status, regardless of how long these symptoms have been present or how normalized they have become. The nutritional response must include protein adequacy for albumin and muscle function, potassium and magnesium optimization for cardiovascular and cellular function, omega-3 fatty acids for vascular and neuronal membrane integrity, dietary nitrates for nitric oxide restoration, and B12 adequacy for neurological function. And the behavioral response must include sleep timing, consistency for cortisol regulation and nocturnal cardiovascular recovery, and moderate aerobic activity to stimulate cardiac adaptation and cerebral perfusion. After cardiovascular evaluation has cleared it as safe, your body does not produce these 4 symptoms randomly or without reason. It produces them in response to specific biological deficits that have specific biological solutions. The worst response to these symptoms is acceptance. The best response is the combination of medical investigation and targeted nutritional intervention that addresses the mechanisms generating them, simultaneously, consistently, and without waiting for the symptoms to become severe enough that the damage they reflect has advanced beyond the point of meaningful reversal. Subscribe and Dr. Darius Coleman will keep giving you the biological context and the specific interventions that turn warning signals into recovery.